Flying with COPD. What oxygen delivery methods can you use? Imagine soaring through the sky with ease, feeling confident that your oxygen needs are fully covered. Traveling by air with COPD can seem tricky, but with the right planning, it's entirely doable. When you fly, the cabin pressure is lower than at ground level, which means less oxygen is available. That's why careful preparation is key to keeping your oxygen levels steady during your flight. The most common oxygen delivery method for travelers with COPD is the nasal cannula. This is a small, lightweight tube that fits into your nostrils and delivers oxygen continuously. It's popular because it's comfortable, simple to use, and reliable. During flights, the usual flow rate is between 2 to 4 liters per minute. If you are on long-term oxygen therapy, your doctor might recommend doubling your usual flow rate during the flight, if possible. Keep in mind, many airlines cannot provide oxygen flow rates above 4 liters per minute, so planning ahead is important. Another option is the Venturi mask. This mask delivers a precise amount of oxygen, which can be helpful for patients sensitive to high oxygen levels that might depress their breathing drive. However, Venturi masks are bulkier and more complex, making them less practical for air travel. It's important to know that carrying compressed gas tanks or liquid oxygen systems on a plane is generally not allowed due to safety rules. Instead, you'll need to use FAA-approved portable oxygen concentrators. These devices work by pulling in air from the environment, removing nitrogen, and delivering concentrated oxygen. They are battery-powered, lightweight, and approved for use on most commercial flights. When traveling, you should notify your airline ahead of time, provide medical documentation, and bring extra batteries to last at least 150% of your flight time. Airlines usually do not allow the use of their emergency oxygen supplies for personal use. These supplies are reserved strictly for emergencies like cabin depressurization. To ensure safety and comfort, it's best to undergo a pre-flight medical assessment. Sometimes, your doctor will perform an altitude simulation test to determine how much oxygen you'll need during the flight. Your oxygen flow should be adjusted to keep your oxygen saturation levels above 85%. Planning for oxygen needs at your destination and during layovers is also essential. Make sure your portable oxygen concentrator is approved for international travel if needed, and carry extra batteries. This way, you can stay active and enjoy your trip without worry. In summary, the best oxygen delivery methods for flying with COPD include nasal cannulas at 2 to 4 liters per minute, portable oxygen concentrators approved by the FAA, and in some cases, Venturi masks. Remember, tanks and liquid oxygen are not permitted on planes. Always coordinate with your healthcare provider and airline well before your trip to make sure everything is set for a safe and comfortable flight.